Good morning. I'm honored to be sharing time with you today. To be having this conversation in my own community in LA County is really meaningful, so I'm thrilled to be here. I want to thank everyone, first of all, for being here as we continue this conversation. It was the perfect setup from Dr. Sharon and Dr. Eduardo into this presentation, and I think the rest of our day together. This is complex and a critical conversation that we have to keep having around trauma and resiliency-informed schools. And I want to acknowledge that we're in a room full of experts and that everyone in this room brings tremendous professional experience and lived experience to the table. So thank you for what you do every day to support children, young people, and families in LA County. I want to acknowledge that I am incredibly privileged to be part of some outstanding teams at UCLA. And so my colleagues really bring passion, they bring brilliance, they bring dedication to partnering with every system in our community that serves children and families, and do so in a way that I feel can really propel and elevate the life trajectories of our community. And we only can do that in partnership with all of you, not just schools, but public child welfare and public health and mental health. So I want to acknowledge them, and I need to spend a moment giving some special attention to a team I've worked with for almost 20 years. We've been funded through the National Child Traumatic Stress Network, and we are the Treatment and Services Adaptation Center for Resiliency, Hope, and Wellness in Schools. It's a mouthful. We're led by Dr. Marlene Wong, who's now at USC. I have colleagues from UCLA, from RAND, from LAUSD, and from USC. And we work across the country and beyond, wrestling, just like we are here, with districts and with schools and with communities around how to provide trauma and resiliency-informed care in schools, how to increase access to quality care for all students, and use schools as a venue through which to do so. We've created a number of school-based mental health interventions for children who have been exposed to trauma, and a number of other projects, programs, and applications to try to support this work. So I do want to acknowledge my team. I have a daunting task in about 45 minutes to try to touch on trauma and its effects. Why are we even talking about trauma in relationship to schools? What are trauma and resiliency-informed schools? With the hope that we all leave here today, after today's discussion, with a new trauma and resiliency lens that's culturally responsive and that enables us to go about our work in an entirely different way. Because if we're paying attention today, we really are forced to do just that. What is childhood trauma? Well, we know that trauma essentially is some type of an inescapable stressor that overwhelms an individual's coping mechanisms. Now let's think about a 3-year-old. What kind of coping mechanisms do we have going on there? What about a 10-year-old? A 16-year-old? What about adults? So when we think about what's overwhelming based on one's coping stressors, our developmental spectrum really comes into play here. Trauma also is an experience either directly or something that's witnessed that threatens one's life or their physical or psychological integrity or safety. So this is a broad spectrum of things. If we look at a few examples of what some traumatic events might be, does anyone look at the screen and recognize that you have students in your school who've experienced one or more of these traumas? Can you raise your hand if any of these look familiar? How many of you have students in your schools who may have experienced 3, 6, 12 of these events? So when we're talking about trauma and traumatic experiences, it's easy enough for us to look at a list of things, of experiences, but it's another for our students to have lived these experiences. So when we talk about traumatic events, sometimes we're talking about acute trauma. These are events that happen a one-time thing. It could be a natural disaster. It could be a sudden loss or a one-time act of violence. Our students also experience chronic trauma. These are things like ongoing abuse and neglect, ongoing witnessing of domestic violence. This could be long-term homelessness, forced displacement, chronic poverty, structural oppression. Our students also experience a historical trauma due to violent colonization, forced assimilation policies, racism, and discrimination. When you're thinking about your students, how many of your students have experienced likely all of these types of trauma? So right now there are students sitting in classrooms all across Los Angeles County, and they're sitting there with a context, and they come into your offices with a context. The fact that they're showing up, as Dr. Eduardo mentioned, is incredible. Here, I want to share a couple of drawings from students so we can really reflect on the context that students are functioning with. Like this student who's breaking up a fight between her dad and a neighbor. This student who's now in high school, but still having intrusive thoughts about violence at home between stepfather and mom years ago. Community violence that our students are experiencing just in their daily lives and activities. And family violence. A startling number of students are exposed to trauma and violence. When we look at national surveys, a majority of young people, by the time they reach adolescence, have experienced an act of violence or trauma. When we look in our urban communities, this figure of exposure to violence reaches almost to 100%. We did a study a number of years ago now in Los Angeles Unified School District. We surveyed over 28,000 sixth graders, 11 and 12-year-olds. Nearly all of them, 94%, reported exposure to an act of violence just in the last year. You can imagine what this might have looked like had we gone back further. In our community, a number of acts of violence also involve knives or guns. Like for this third grader who lost his father to gang violence. And this seventh grader who on his way home from school witnesses the reverse of a drive-by shooting and is protected only by the slats of a fence. So these are the contexts that our students arrive in our classrooms, in our offices, in our mental health clinics with. And the impact of violence and trauma, as we know, can be profound. Children who experience trauma are more likely to develop post-traumatic stress symptoms, what we call child traumatic stress, including PTSD. This also impacts their relationships, right? And we know that relationships are some of the biggest protective factors for our students and for our children and young people, with peers and also with other adults. We also notice emotional and behavioral problems. Is this familiar to anyone? Anything? Self-medication. Sometimes very externalizing behaviors, and aggression and impulsivity, and other times very internalizing anxiety and depression and isolation and withdrawal. You can only imagine, given all of this, that this affects students' performance in schools. When students are having trouble concentrating because they're having intrusive thoughts or flashbacks about those very images we just saw in the drawings, you can imagine they're having a hard time with their spelling test. They're not exactly maximizing their learning around the periodic table, right? The other thing that's a part of this is that post-traumatic experience, students are avoiding people and places and things that remind them of their traumatic experience, that are triggers. And there are a number of those that can happen in the course of daily life in schools. As Dr. Sharon was pointing to earlier, put simply, our brains are actually set up for survival. So we have a very normative, adaptive response when we have threat in our environment. When something frightening occurs, our amygdala is triggered, an alarm is set off, it overrides everything else because we're all about survival in that moment. We've kicked into our fight and flight response. And so when that happens and this alarm goes off, we're not accessing our rational, reasonable, organizing, planning, executive functioning frontal lobes. We're in our survival brain. And because of when these events occur, our hippocampus then is encoding potent memories and schemas of this traumatic event. What happens then when this very normative response is really taken advantage of in our students' brains. And that is either they're having ongoing trauma and threat, or they're having consistent reminders that have the same physiological response as if the same thing was happening again, as if the threat was real. So real or perceived ongoing chronic trauma then produces these continual alarm systems in the amygdala, meaning we're never being able to tap into that rational planning, organizing, executive functioning brain. And then our hippocampus starts to develop in a different way. It's not a brain maximized for learning. It's not a brain maximized for relationships. I think a lot of what we've learned about brain science related to trauma is really critical for us to understand. But one piece that often is left behind is the fact that there's nothing wrong with these responses in the brain. The brains are doing what they're supposed to do. This is an adaptive response. The problem is the environment. We shouldn't have kids in environments where they're constantly set up to be on survival mode. And I also want to recognize the resilience of the brain as we start to move forward. Has anyone heard of the Adverse Childhood Events Study? I'm guessing most of the room. I want to share a quick video around ACEs, but also with a new lens that I think is relevant to our community.
In the mid-90s, Doctors Vincent Felitti and Robert Anda published groundbreaking research assessing the links between childhood adversity and adult health and well-being. In the original Adverse Childhood Experiences Study, known as the ACE study, 17,000 mostly white, mostly middle-class adults were asked about 10 different types of childhood adversity. When you were a child, were you physically or psychologically abused by parents? Did you live with someone who abused drugs? Were you neglected? Was there domestic violence? Did anyone go to prison? Was someone in your home mentally ill? Respondents were assigned one ACE for each of the 10 types of adversity experienced. Surprisingly, more than 1 in 5 of this mostly middle-class population reported 3 or more ACEs. But even more eye-opening was the correlation between childhood adversity and adult mental and physical health.
The higher the ACE score, the more likely people were to suffer from things like heart disease, liver disease, lung disease, depression, suicide, IV drug abuse, and alcoholism. What it said was, we've got a common causality for all of our major health and social problems. And it was all related to what had happened to them as children.
But researchers like Dr. Roy Wade could see the ACE study didn't take into account economic distress, let alone hunger, housing insecurity, and other hardships in low-income neighborhoods.
When I came to Philadelphia and I saw the huge amount of blight, the community violence, the episodes of racism and discrimination, those are stressors too.
When Philadelphia researchers expanded the ACE survey to add questions about racism, neighborhood safety, and violence outside the home, they discovered that while 14% of the general population reported 4 or more ACEs, in Philadelphia, that number was a startling 37%.
Poverty is an adverse childhood experience that gets under the skin. Living in economic distress can actually translate into long-term negative health outcomes, even for the most resilient individuals.
So Dr. Wade is referring to Philadelphia, but his words really could apply to our own community and a number of other cities and communities across the country. I imagine it's not of any surprise to anyone in the room that adverse childhood experiences impact learning. That more than half of children with ACEs scores of 4 or more have learning or behavior problems in school, compared to only 3% of children with no adverse childhood experiences. Research shows us that traumatic experience takes a measurable toll on academic achievement in many ways, with studies citing decreased IQ and reading ability, more suspensions and expulsions among students exposed to trauma, more absences from school, lower GPAs, and decreased rates of high school graduation. But I think we can all agree at this point that schools can be an ideal setting, in fact, for helping children who have experienced trauma. And there are a number of pieces to this. Schools are where students are. There are a number of obstacles that can be avoided when we bring the services that children and young people need to where they are. Most young people with mental health needs do not seek treatment. How many of you have made referrals into the community for mental health services and not had a student attend? Why? There's numerous obstacles around stigma, around transportation, etc. And being able to provide services in schools is meaningful and increases that access to care. About 3/4 of students who do receive mental health services receive it, access it via school settings. So in many ways, again, schools are the ideal setting for both detecting, asking the right questions, and intervening with children who might have child traumatic stress symptoms and that clearly can interfere with academic performance. The other big piece here is that enabling all of these services in schools can really reduce disparities, especially for underserved children who do not access health and mental health care via traditional routes. It's also a huge task. It's a daunting task. Schools are asked now to do more and more than they've ever been asked to do. There are some great concept pieces and papers out on this topic. This is something we've been thinking about for at least 20 years. We now have National Center for School Mental Health, which is another team that we partner with. These are great frameworks developed by SAMHSA, as well as the state of Massachusetts. There are others that our team is working on. For example, the SHAPE program. There's an endless list of resources at this point for schools around mental health. So what the heck is a trauma-informed school? I hope today we leave here thinking about trauma and resiliency-informed schools. I want to talk about the foundations because I only have a moment to touch on each of these things. That could be a very long talk. Essentially, trauma-informed schools, they bring to life 4 R's, realizing that trauma exists and its prevalence and its impact on our students. It recognizes the signs. It shifts from a deficit model to recognizing how behaviors make sense given students' histories, experiences, and context, and how we then can respond and provide appropriate learning supports. A trauma-informed school responds to trauma in developmentally appropriate ways, figuring out what services and supports create a learning brain and help enhance student success. And finally, trauma-informed schools resist re-traumatization. So what we integrate into our school systems, all of these principles of trauma-informed care happen both in the classroom, during passing periods, at lunchtime, en route to and from school, and among the school's adults and faculty and staff. Oftentimes, the pillars of trauma-informed schools are undercut by these 6 key foundations of trauma and resiliency. Again, each of these could be a talk in and of themselves. Safety and trust and transparency in the school community. Peer support, recognizing the impact and power that we have among peers. Collaboration, mutuality, empowerment, voice and choice, and cultural humility. We used to talk about RTI models, and now for many years we've been talking about multi-tiered systems of support. Because a trauma-informed school is really the foundation for a range of interventions then that students who've experienced trauma and adversity can access. How many of you in your schools have MTSS teams? Terrific. And so you all are experts in this already. Essentially, an MTSS continuum is built to facilitate the 4 R's that we're talking about. And students move along this continuum at various points during their education. Here's an example of how one school embodied their MTSS programming. So universal MTSS supports are for all students. These benefit all students. These are things like PBIS, maybe mindfulness practice, social emotional learning. For this school, they use psychological first aid for educators, listen, connect, protect. So these are the school-wide ecological strategies and programs. Could be an Olveus bullying program, for example. Tier 2, you're looking at students who you know are at risk, for, in this case, for trauma. And these are preventive or early interventions that you can implement in the schools. In this case, they were using our Support for Students Exposed to Trauma program, which is something implemented by educators and school counselors, as well as for early intervention, they were using Bounce Back and cognitive behavioral intervention for trauma in schools. These are group school-based interventions. And for Tier 3, these are selective interventions, oftentimes individual interventions, to remediate the adverse effects and impact of trauma and to avoid re-traumatization. And so for this school, they were using trauma-focused CBT, both by their school-based social workers as well as by co-located mental health clinicians. So all in all this morning, I think what we're all trying to get at, the lens that we're trying to use is culturally responsive, trauma and resiliency-informed schools, which is just a lot of words strung together. So let's talk about that. How many of you have heard of a trauma lens? Okay. So our trauma lens takes us from the perspective of what's wrong with this student to what has this student been through, right? So oftentimes, given what we heard this morning, that could be a list of adverse events, a list of traumatic experiences that they've had. And I want to urge us that this lens has to go beyond just that listing, that we have to recognize that each individual student has an individual context, and we have to take into account their full history, their full experience. So for example, if you have a child or young person who's been involved in child welfare, what added context does that bring? They might have been torn off the chest of a loved one, of a caregiver, and removed it to a different home. And that could have happened several times. So we also have to consider attachment. Children in child welfare have a great deal of unresolved grief and loss. They're dealing with grief and loss to an extent that nobody of any age should have to have bundled on top of each other. And you're talking about loss not only of caregivers and loved ones, but we're talking about loss of you all, their teachers, when they change schools 6 times in a school year, their friends, their pets, religious figures in their lives, their coaches, their belongings, their culture, their neighborhood, all things familiar. Adding that to the context broadens our lens. What about recently immigrated children or refugee children and newcomers? What was their experience in their country of origin? What was their experience during the immigration process? How valued do they feel as an immigrant in our country, in our community? That's also part of this lens. It might be with military families and the impact of deployment of a caregiver or both caregivers. The impact of moving every couple of years. With families, we could go on, who have a family member reintegrating from the criminal justice system. All of these pieces have to be part of an individualized lens for students as well. And when we think about marginalization, when we think about our students of color and our LGBTQ and SOGI youth, what is the impact of discrimination? What is the impact of daily potential microaggressions and marginalization? All of this now is a holistic lens, culturally responsive, trauma and resiliency-informed lens. And when we start to view our students in this way and recognize this, we're now forced to leave this room, to go out these doors and do our work in a different way. We have to approach students, we have to approach children, young people, and family with this lens. So we talked about the trauma lens. Instead of what's wrong with this student, what has this student been through? I'd really like to ask now, how often are we asking, what's right with this student? What are the student's strengths that we can build off of? Are we talking as much about the trauma lens as we're talking about a resiliency lens? How many of you are having conversations and going to webinars on resilience? Great, and hopefully more and more. I don't think we know yet exactly what a resiliency lens is, but if we want to get to well-being and wellness, we certainly have to start to consider it. I want to share for just a few minutes some ways that I see educators using resiliency lenses. Because again, you all are the experts in trauma and resiliency, even if you haven't labeled it as such. The first thing we have to do is recognize that sometimes what we see as deficits or difficulties with children and young people are in fact exquisite adaptations that these little human systems have made to survive in incredibly chaotic and sometimes abusive environments. And when we recognize now that we have a strong and an adaptive young person, our lens and our approach shifts. And when we help them recognize that strength in themselves, then they're able to go about their functioning in a different way. One way that educators do this every day with things that seem small but are meaningful to students is just recognizing them. I'm glad you're here today. I missed you on Wednesday. Dr. Sharon mentioned connectedness and a sense of belonging and honoring and building that. And you all do that in schools every day. Being able to be future-oriented. I can't wait to see what you do with this assignment. I can't wait to see you when you graduate from high school and how much you've learned from this point until then. Creating a role for a student in a classroom where they know that they belong, where they know if they're not there, they're going to be missed, that's something all humans desire. That's going to build resilience in everyone. And educators also focus on the wins. So I'll tell you this perspective for a young child. 2 kids were placed with caregivers in foster care who had a tremendous resiliency lens. They were told these kids likely have learning problems and they will probably always be in special education. One of the kids entered kindergarten. They got a call home from the kindergarten teacher who said, "Oh, we have a problem. Sean has written his name all over the walls." So the caregiver put down the phone and yelled to her husband, "Mike, Sean can write his name." So it's finding the win in that moment, and then, of course, appropriately working with the teacher, but also the shift for that educator to be like, "You're absolutely right. You're absolutely right. We can handle this, and let's see the strength. Terrific. Now, where can you write your name appropriately?" And also another story with a vice principal, with an assistant principal, sitting in an IEP meeting with a high school student who had recently come out of the hospital because she'd been suicidal. And so in the meeting, her caregiver, who was a relative caregiver, was exhausted and started to feel really deflated when one of the teachers was saying how, well, she's been here this week, but she hasn't turned in any worksheets. She hasn't turned anything in. And so seeing this sort of deflated caregiver for the principal to be able to stand up and say, let's take a step back for a moment. This child doesn't want to die today. To my knowledge, she hasn't cut herself in 3 days. She's sitting in our classrooms. That's the win. So being able to focus on the wins and recognize that success is individual for every student and the context that they're facing in every moment, and helping to find their success sort of gets them to the next moment. And sometimes that's all they need. The other piece of this is we can't just keep telling students that we're going to teach them new coping strategies, because if the coping strategies aren't a match for their environment, it doesn't make sense. And oftentimes what students are dealing with are real, right? We need to also name when things are unjust. It can't just be, let me help you deal with this injustice and give you new coping strategies around it. It means we have to name and create space to recognize that that things are unjust, and the work we do is also around social justice in education and well beyond. Finally, I want to just say it's so incredible. All of you every day are often talking about stabilizing kids in schools across the county, stabilizing families, catching kids up to grade level, and that's critical, and we have to keep doing that. My hope is that we get beyond that. We get to start to talk about students thriving, students flourishing, not just catching up. And that's where resilience and well-being are such a critical part of this conversation. So our question now is, how can our schools create the conditions within which resiliency can emerge? Many of the protective factors that research shows us are key. Makes sense for all of our students. You all are doing things in schools that are promoting resilience, or can, every single day, by providing caring and supportive relationships, individualized high expectations for success and what success means for each student, opportunities to belong and for meaningful participation. And also, you're building internalized factors where students feel a sense of value and worth, that they can interact socially. They know how to solve problems because our students have real life problems. They need our help in brainstorming options and figuring out the best way to respond, or even knowing that they have options and how they can respond. We're building a sense of self-reliance and autonomy, and a sense of purpose and hope for the future. Oftentimes your teachers might ask you, okay, I get it. We want to be a trauma and resiliency-informed schools, and that's a process and an evolution. It's not an end point. Well, what the heck do I do today? What can I do to support my students in my classroom today? Well, this is a whole other talk, of very concrete things you're probably already doing and can expand upon. One thing we do, schools might be the only place during a student's day, during a student's week, where they are safe. Let's make sure they are. You can accept no bullying, no teasing. Students need a zone safe from racism, from sexism, from homophobia, from microaggressions. Consistency may be something students only get at school. Consistency, and give students choice and predictability. Don't jump out from around the corner at them. Let them know exactly what to expect, how they fit into it, and where they have choices along the way. Young people process their adverse and traumatic experiences through their relationships, through their interactions with others. It sounds strange, but traumatized students will sometimes try to pull from other adults behavior that they've had in their lives. So when we start to feel pulled and we get those triggers, right, from students, that ever happened to anybody? That's actually a time for us to step back, to recognize what's happening. Believe it or not, that's reassuring for them, because then they see, oh, see, yes, I know this is how I interact with adults, and it's happening again. When we shift that trajectory, we're changing pathways in the brain. We're helping students recognize there's a different way that adults and authority figures can interact with young people. So taking a moment to sort of not be triggered ourselves, to self-regulate as adults, and recognize this as a teaching moment is critical. We also have to start recognizing very common behaviors in a different way. We have to move from a deficit model. We can't just think about the deficits in children's behaviors. Now, all of these behaviors listed up here, anyone ever have these issues in your schools or in your homes? We have to recognize that these very behaviors may have made a lot of sense in a previous environment or in their current environment. For example, when you have a student who's stealing food out of kids' backpacks, that's never fun, right? So we can punish that behavior and we can send for disciplinary action, but is it going to stop? That child likely is doing that for a very adaptive reason. They don't know when they're getting their next meal. They might be feeding siblings or their parents. This is a strong, adaptive child or young person who's doing what they need to do to take care of themselves in a potentially chaotic and unpredictable or abusive environment. When we recognize students in that way, our response is different. A trauma and resiliency-informed approach might be something like providing food for that student in the teacher's desk that they can go and get when they need it. Recognizing when they have that deprivation trigger and giving them something appropriate to fill it with. We have to differentiate trauma reactions from defiance. It's easy for us to see something as oppositional when in fact it makes a lot of sense given what students have been through. How do we create the conditions within which resiliency can emerge? Everyone is a genius, But if you judge a fish on its ability to climb a tree, it will live its whole life believing it is stupid. How many times and how much time and energy and effort and expense do we put into children who might be struggling with math? They have math at school, they have pull-out for math, and then they go to Kumon or have tutoring after school. We have to spend the same amount of time, energy, and effort on things that they are good at, help them find their strengths. What are they passionate about? And we have to support that because we know that's a huge protective factor as students enter into adolescence. They need to have extracurricular activities that build their self-esteem, make them feel good about themselves, put them into an appropriate peer group. They're monitored and supervised after school. They may not be able to perform well, whether it's playing football or playing a musical instrument or being in theater or art, if they're high, for example. So these things become huge protective factors as our children reach into adolescence. So I will close with hope and the power of school relationships, that school is a place where it's possible for traumatized children to forge strong relationships with caring adults and learn in a supportive, predictable, and safe environment, and it may be the only one they have. We know that mastering both academic and social skills are key to the healing process, and that school administrators can partner with educators, with parents and guardians to provide support not only for our student wellness and well-being, but for adult wellness and well-being. That we can create access to evidence-based resilience and mental health programs. We can best understand and protect students, model our own self-regulation, and whole person development. Thank you for what you do each and every day to help students bounce back and thrive. Thanks for having me.